Good morning, students. All are well now. Today I will be dealing with the new topics, that is nursing records and reports. This is in 10th unit. Nursing records and reports in 10th unit. Records contain written evidence of the activities of the organization in the form of letters, circulars, reports, vouchers, minutes of meeting. Records are the records. We can see it's a documentation. Records contain written evidence of the activities. It is the written evidence of the activities of organization in the form of letter. Records may be letters or circulars or reports, or it may be vouchers or minutes of meeting and many other records. Always records kept under safe custody. Record should be kept under safe custody. Record is a clinical, scientific, administrative, legal document. Record is a clinical. Clinical means related to the hospital. Then scientific related to research. And administrative, legal document. Legal means related to law. Document relating to nursing care given to the individual. This is the nursing record. Record is a clinical, scientific, administrative, legal document relating to nursing care given to the individual. Next, we will see the definition of records. Records are defined as legalized documents that cover the patient details documented by the doctors, nurses, social workers, and other healthcare team members in a confidential manner. Records are defined as legalized. Legalized means related to law. Legalized documents that cover which consist of the patient details documented by who all members will document by the doctors, nurses, social workers, and other healthcare team members means maybe paramedicals or nutritionists or any other healthcare team members in a confidential manner. Record should keep under safe custody, that is confidential manner. This is the definition of the records. Next, we will see the purposes of records. What are the purposes of records? First one, provides documentation of the services that have been rendered. Records provide documentation of the services. What all care we give, that care all will documented. That care all will written in the nurses or patient chart. Provides documentation of the services that have been rendered. To provide the practitioners with the data required for the professional services. If a new staff is came to the hospital, she will give all required data. That also is a record. To provide the practitioners with the data required for the professional services. Then act as a tool of communication between healthcare team members, family, and other development personnel. Record act as a tool. It is act as a tool of communication between healthcare team members and family. For example, the family members will give the information about the patient condition. The doctor will document all this in the patient chart. It's a tool of communication between the healthcare team members, family, and other development personnel. A record indicates plan for future. With the help of record, we can plan future. For example, patient chart, past history, we can plan the future care. It provides baseline data for estimating long-term changes related to services. With the help of records, we can plan long-term changes related to the services. Health record shows the health problems in the family and other factors that affect the health. Health records shows the health problems in the family. All details will in the health record. For example, student health record, all the details of the students in that student's health record. Health record shows a health problems in the family and other factors that affect the health. These are the purposes of records. Then, what are all the records used in hospitals? What are the records used in hospitals? First one is admission record. A admission note is a part of medical record that documents the patient status, reasons why the patient is being admitted for the inpatient care to a hospital or other facility, and initial instructions for that patient care. You might have seen the admission record. In that, age, sex, patient address, cause of disease, admission date, all will included in admission record. Admission note is a part of medical record that documents the patient status, details of the patient, reasons why the patient is being admitted for inpatient care to hospital, why the patient is coming to hospital, what is the causes, what are diseases, diagnosis, or other facility, and initial instructions, what all instructions will give to the patient for that patient care. These all included in the admission record. Then second one is medical history record. Required medical history includes immunization, allergies, nutritional and psychiatric evaluations as necessary, past medical history, present medical history, past surgical history, social and family history, and any screening test, HIV, PDRL, that have been performed. All this will included in the medical history. Required medical history includes immunization history, any allergies, nutritional and psychiatric problems, past and medical and surgical history, social and family history, any screening tests that have been performed. First one is admission history, then medical history. Then physical examination. A thorough physical examination record. A thorough physical examination should be performed and documented in the patient chart. After coming to the hospital, the physician or doctor will examine the patient thoroughly and give the impressions. Thorough physical examination should be performed and documented in the patient chart. You might have seen according to system wise. This includes patient vital signs, general appearance, head, eye, ear, nose and throat, neck, chest, CVS, abdomen, extremities, and neurological evaluation, system wise evaluation. It is the physical exam. After examining the patient, the doctor will write the findings for the all system. Then laboratory and radiology record. Result of all laboratory test, screening test, pathology report of any tissue or body fluid, and radiological assessment that are required in a hospital documentation. In X-ray and lab department, there is a record. They will write all the tests done by the lab. All X-ray taken in the X-ray department. There is a X-ray record and